love. Main reason is you can certainly make a big difference when you really meet their needs. I want to discuss a trend that I see, and that is I believe it is so important to provide more content value than what is available online. Online for free, online on websites, online through forums. All of that knowledge is well respected. However, personally, to come and have a financial transaction to just talk about liquids post surgery in the appointment pre surgery, I believe is not great value whatsoever. Now, my experience back past 23, 24 years when I started, and there was not much free information online. I found that to encourage people to come back, I organized appointments at intervals when I knew an issue would arise. So pre-surgery, obvious discussion, 2 weeks post, transition phase. And then around the 6 to 8 week mark, long-term eating plan, meal suggestions, portion control, because it's more relevant. As the industry online content changed, personally, I found it a little bit challenging to get people back. It is a known fact and a common occurrence where patients will utilize what service is offered as part of the program, whatever that is. Post that, there'll be a small percentage of people who stay on board. I used to run online face-to-face support group meetings each month. They were great. Then eventually, once the online industry took over, things changed again. So I have evolved with time. And I honestly believe as allied health, we must be providing more information that's on than what's free online, tailored with ongoing support. The method that I like to use to add as much value as possible in the first appointment, which also adds credibility, value, and it encourages people to return. I pre-educate because there's that core element that everyone needs to know. Pre-surgery, immediately post, the core repetitive information that we need to tell that person. So why not pre-educate that? Give them time to digest all that information. I also provide information how to succeed long term. The key take-home nuggets. I explain it in the method of filling in the gaps of their current knowledge, respecting what they know, filling in the gaps with the simple, practical, easy method of suggestions to implement. So pre-surgery, I highlight with them what their key issue is. Commonly, it's eating to fullness or not feeling satiety. I discuss what that is and use that as the main learning curve to move forward, because I don't want them to look for restriction post-surgery. So as I pre-educate them pre-surgery, they can watch those series of videos with their family, their partner, so everyone has an awesome understanding. When we get to clinic, I iron out the basic knowledge and then I individualize it. So what is their individual concerns, medical needs? Because when they've got that awesome background information, whatever response you provide to a question, it's in context of a better level of understanding. That's my strong belief. My strong belief is we should be providing more than what's free online. Yes, tailored. It's really the coaching to help people make those changes and dietary needs as they come up as well. Combine the two and the best results are there. Hopefully that helps some of my experience of the last 23 plus years. If you have any questions, want to clarify anything, feel free to connect and ask me any questions directly. Thank you.